Everyone, it's Karen from the Beyond IVF Baby channel. I'm so glad you're here. Today I'm talking about a very sensitive topic, and that is coping with a miscarriage or a planned D&C after you learn your baby no longer has a heartbeat. So whether that baby was an IVF baby or a naturally conceived baby, you're going to be going through a whole whirlwind of emotions either way. Let's first break down the D&C and what risks could be involved. And could I ask you a favor, please? If you wouldn't mind liking and subscribing, it really means a lot to me to help grow my channel. So, the D&C. I've gone through several of these, 3 to be exact. And initially, my very first pregnancy, which was termed a missed miscarriage, I was hoping to go through the process as a natural miscarriage. But after a while, during that time, I was working, I was taking care of my sickly father. It was a lot going on. So I kind of realized this miscarriage and having a natural miscarriage and being able to use the collection cup that the RE gave me, this was not going to work out. I felt totally out of control, not knowing when when this would actually happen or complete, how long it would happen, and all these things. So since the only 2 options were let it happen naturally, typically pills are not offered. I don't know anyone else on the fertility journey who was given a pill to facilitate a miscarriage. Maybe that's in Europe or other places, but not here in the United States. So I ended up going to my RE, since he did offer, and all REs offer that procedure. Some gynecologists and OBs also offer that procedure. You just have to ask, or some of them will let you know after they break you the bad news. So in terms of the D&C, not every D&C is similar. So my very first one, it was not horrific. So basically, a date is planned that works for you and the doctor. You are given sedatives because I'm the type of person, I just want to be sure. I wanted to do a final ultrasound just to make sure nothing was obstructing the heartbeat, or in my case, heartbeats, because there were 2, I guess we would say fetuses at that point. So I just wanted to be sure. So we went ahead and did that, and then you're given anesthesia and things like that. So you are out for the whole thing, and you are given typically pain-killing medication, painkillers afterwards. With that one, I would have to say the pain wasn't horrific. Maybe I took a painkiller once or twice. It was not awful. There was a lot of bleeding afterwards, so yeah, you have to wear a pad. There's cramping, but it wasn't horrific. Of course, it's going to keep you out of the gym, and you're going to be taking it easy. I would say for at least a couple of days. I would not say a full week. That's in contrast to some of the other D&Cs I had, where I'm gonna say one of them was like so horrific. I had to take a lot of painkillers. I had horrific bleeding and still blood, and I guess I'm gonna say maybe tissue was still coming out. So that one was a more rocky one a couple years later. And then the final one I had with that particular reproductive endocrinologist, I think it was kind of like, it was okay, nothing dramatic. However, around the same time, I started working with a reproductive immunologist, and part of their process was, during the process of becoming a new patient, you would do an ultrasound with them in their clinic. So I ended up flying into Chicago, where I learned my HCG numbers weren't going down fast enough and according to the ultrasound, it wasn't a complete D&C. So I was instructed to stop taking prenatals and continue to monitor to make sure the HCG number goes down. Obviously, that's important for many reasons because, well, one, you're not going to get pregnant again if you still have HCG levels that are high enough to be detectable, or to make you be considered pregnant. So that's something to keep in mind. Now, with all of these D&C procedures, nothing went wrong. I never suffered any consequences in terms of not being able to get pregnant again. However, I know other women who also, maybe their first D&C ever, they came down with something called the Asherman syndrome, which basically is creating a lot of lesions around the uterus. So it's extremely difficult for an embryo to implant. So there are consequences of a D&C, even if it's done with care, even if it's done by, you'll say, a doctor who is in the business of trying to get you and keep you pregnant, because that's their bottom line. So in terms of the physical, nothing was too horrific, but just expect there's going to be cramping, there's going to be a lot of bleeding, and it's going to feel more than a really heavy period. It's definitely going to feel more severe than that. So you're going to be able to take it easy a little bit. You may or may not be able to return to work the next day. It just all depends on your threshold and how understanding your boss may be, but it's going to hurt. In terms of the emotional, if you don't have a strong support system, you may not get the support you would want from your partner because maybe, well, we'll just say like males are just going to deal with emotions differently than females typically will. So you might not get the support you want. This is a good time to turn to someone else that you know from your group that may have experienced a miscarriage for support, or to turn to a forum or a Facebook group where you can turn to for support, or a trusted counselor or therapist where you can turn to for support as well. These are all good positive ways to help deal with the emotional side and processing of all that. In terms of when you may feel like trying again, you might be ready the next month, or you may need a little bit more time. You might need a couple of months before you feel emotionally ready and prepared for potentially getting pregnant and that pregnancy not materializing as well. For anyone who's experienced repetitive miscarriages, you know exactly what I mean, whether you're having natural or if you're having D&Cs, you understand exactly what I'm talking about. Other things to keep in mind is if you go on to Etsy, and probably much more limited on Amazon, you can do something to honor that lost embryo. They have miscarriage necklaces and bracelets and figurines and all kinds of stuff. And honestly, there are a lot of support groups apart from Facebook, which are all they deal with is loss, whether it's miscarriage or a stillborn birth, or early like SIDS, early infant or toddler loss. There are groups like that exist, and I will link that in this video. And then let's talk about the after the emotional side, what you can do for support. We can talk a little bit more about the physical changes you might notice. You might notice that you feel kind of emotionally detached or whatever you feel less hopeful or whatever because of this whole experience, I'm encouraging you not to get stuck there. I mean, yes, you have to go through the process and deal with things how best would suit you, but you need to be really careful, being too focused on the past and the negative, and try to bring some courage and happiness to help draw in a new healthy pregnancy. So with that being said, things that I would suggest that were probably the most helpful was Etsy and looking at, what can I do to honor this lost baby, potential baby. I know based on science, the development of embryo, fetus, and baby, there's different lines, and I will just kind of use them all interchangeable, even though it's not really correct or medical to do so. But you get the drift of what I'm trying to tell you. And I can say basically it's a very tough space to be in, but you will get through this. You will find the hope to try again, and you will have new knowledge and new insights. And I would say for me, I like to read when I had time to read. The miscarriage books that are out there, I didn't find them particularly soothing or helpful. Like, I just kind of could identify with these women, but it certainly didn't make me feel any better. So that really wasn't the route. Just getting really something where I could say, like, yes, this is a part of my history and my past, and this is a way to give some honor and remembrance to this lost fetus. And I think that's an excellent way to be healthy and in a way to process everything. So it is a highly sensitive topic, and things have gotten political. So now we know, depending on which state you live in, if you're watching from the United States, there are laws who and how far along you can be to get a D&C, and there's also rules with heartbeat versus no heartbeat and all of these things. So it has become more complicated today versus a few years back during my initial first D&C in 2016, and moving forward to today, where it's just a lot more complicated, and women have to sometimes leave their state and go to a new state in order to do it. But that's a different topic. You do need to be aware about the different laws and regulations, and that does perhaps limit what is offered to you. So I'm rooting for you to hang in there. And if you have any particular questions about the process of a D&C or a natural miscarriage, and I have to say, all of my natural miscarriages were really early. It was basically, I learned I was pregnant, I started to get monitored, and then it was like, boom, I have a period. So it wasn't the grueling process of knowing there was going to be a lot of visual things I might see pass besides tissue. So I'm not going to be too graphic, but you know what I mean. You can see those videos that are out there on YouTube. But hang in there, and if you have any direct questions that I might be able to help you with, feel free to ask, and I'll be happy to answer to help you get through this rough period in your life right now. So please stay with hope, and let me know if there's anything else I can do to help support you on your pregnancy and fertility journey. Until next time, I'll see you then. Ciao.